Welcome to the Deep End Podcast. This one is a really cool episode because two of my really good friends have joined, George and Chris. And the reason we wanted to do this is multifold, but we are branching out and doing many surgeons across the field of plastic surgery, from younger surgeons, mid-career surgeons to late surgeons, and people who are innovators. And Chris and George are definitely those who have very busy clinical practices and have contributed a lot in their early careers. I look up to them and I turn to them a lot too for advice. And so this is very special to me. So we'll start with Chris. Chris, I've known you for some time. We've chatted a lot at conferences, even before that, when I was looking at different microsurgery fellowships and things like that. Tell us about what got you interested in plastic surgery, a little bit about your practice, your interests, and things like that.
Thanks. Of course, thanks for inviting us here. It's great to be here, and
you're in Cyprus. You're joining us from Cyprus. We're honored.
In Cyprus right now, yeah, and being watching.
I'm sorry you're wasting your time on the podcast in Cyprus.
That's great. I've been watching a lot of those, and I enjoy them. So thanks for having us here. So I kind of started. Obviously, I grew up in Greece and then Cyprus, and going to med school, I thought I'll be a cardiothoracic surgeon because my dad is cardiothoracic and vascular. But kind of midway into med school, I kind of realized that I wanted to do plastics for a bunch of different reasons, including all the things that people say about the variety and how cool things are, and all that. But I kind of transitioned to the US and I did general surgery, plastic surgery, microsurgery training, and I've been in Colorado since 2019 when I basically finished my microsurgery training at NYU.
Yeah, and you were at plastic surgery. Tell us a little bit about your plastic surgery training and your training before your microsurgery fellowship.
So I did, coming from England, it wasn't easy to match, but I did. I went straight to general surgery training in Ann Arbor, St. Joe's in Ann Arbor, and then after that, I went to Vanderbilt for plastic surgery training. Obviously, I followed independent pathway, and after that, I matched at NYU. Last year was a combined fellowship, so I did NYU and MSK for a couple of months, which was great because I was able to.
I remember that.
Meet all the surgeons, work with them, legends in the field, right? So it was a great year there. So
yeah, and that shows, we've talked about this before with other guests about when you're coming from overseas, how, you have to take sometimes the longer route. And, George can talk about this too when it gets time to him, but the independent residency training and then, kind of going where you can to start. And then clearly you went to some of the top places after that for your plastic surgery training, which is great. And you've been at a very strong academic program right now. What's your practice look like?
So my practice is, it's sort of diverse. I do, in terms of reconstruction, I do a lot of breast reconstruction, and I do some general reconstruction and some complex microvascular reconstruction, gender surgery, and also aesthetic surgery. So fairly diverse, but I do enjoy it. I think it kind of blends well with what I like and what I do, and it's been great for me.
And something that's super interesting, Sai, we've noticed a recurring theme, and a high percentage of our guests have said that they thought about cardiothoracic surgery before going into plastics. I wonder if that's something that we need to research or investigate further. I know your father, has a background, so that's for you. But it's interesting how so many of our
zero,
yeah, but it's
Same
super
here.
interesting to me.
For me, it was my dad, and also I think the microvascular component of the cardiothoracic surgery and vascular surgery, which
that makes sense.
Well, with microsurgery, which obviously is what I like, part of what I like to do in plastic surgery, right? So I think it's it's more precise in plastic surgery. There's more finesse to it in plastic surgery. And that's why I liked it more eventually.
Yeah, more. It's very elegant. George, so now you tell us about your practice, your current reconstructive microsurgery practice at Rush, and also your journey into plastic surgery as well.
Yes, again, thank you for this opportunity. I'm a fan of the different podcasts I've been
We're a
watching
fan of you, George.
religiously. Well, thank you. But similar to Chris, as Chris said, it took me 11 years from the moment I started here until I
Me
got
too.
my first job. I was 2 years of research. When I first came here, I went to Duke. Howie Levinson gave me a spot in his lab, and I did 2 years of basic science research, built up my CV, kind of network a little bit, and I got into the general surgery program at Duke. Graduated, went to Hopkins for the independent residency program where I actually met Saeed. We got to do some cases together when he was a general surgery resident there. And then I went to Sloan Kettering for a year. By the time I made it to Sloan, they had dropped the collaboration between the two institutions. So I got to spend 12 months at Sloan. It would have been nice to spend a couple of months at NYU as well, but nevertheless, that was a great experience. So much good training, mentors I met throughout all these years. People who didn't have to help me, but that's what I like about this country. It's the land of opportunities. You work hard, doors will open for you, and I feel like both Chris and I were like the perfect example of that kind of the American dream, where just put the effort in, you're gonna make it happen. So fast forward, I've been at Rush for 6 years now. And 95% of my practice is breast reconstruction. I do a lot of flaps, do implant-based reconstruction. We do some lymphedema cases here as well, and some breast and body contouring cases. And it's a very good practice. I'm very excited to be here, and I'm looking forward to having more discussions with you guys today.
So when did artificial intelligence become a focus in your career, and when did you become interested in that? Was that a long time ago, or did it kind of match, everybody else's, interests and how it's exploded in recent years?
Yeah, I will say it's a little bit of both. I feel like I was always drawn into innovation, and if you think about it, artificial intelligence is the ultimate generational innovation. It will impact our lives. It's almost like the internet. It's here. It's not going anywhere. It opens tremendous opportunities to improving. I kind of started this journey a little bit early. I was one of the early adopters. I was just very interested in it. Now it's becoming more of a mainstay, for sure. And if you think about it, plastic surgeons, and I know you've had a lot of plastic surgeon innovators in your podcast. We are very innovative people. So it's not any surprise that AI is getting very much into the plastic surgery practice. It's just because we like to do that and embrace technology.
Yeah.
I was always drawn into innovation, and I think that the artificial intelligence is the ultimate generational innovation that we are all going to be using to improve our practices, workflows, educational research. Pertinent to what we do as reconstructive microsurgeons, reconstruction requires a lot of preoperative planning, then execution and perioperative care of patients. And this is where artificial intelligence, by leveraging a lot of data, can help with each one of those steps. So, for example, for preoperative planning, there's all these AI-based clinical decision tools that help with algorithmic approach to making decisions for surgery. There's an overlap between artificial intelligence and imaging technologies like augmented reality, where you can pretty much visualize the procedure before you even make it to the operating room. And a lot of these things are just very rudimentary at this point. They will only evolve and get better. When it comes to the actual execution of the procedure, there's a lot of video analysis that, can help you by visualizing the microsurgical anastomosis, the perforated dissection. It can predict outcomes, which is very unique if you think about it. So, but this is going to be the future. Same thing with patient care. What artificial intelligence is pattern recognition. So there's a lot of things that we cannot see with the human eye, and artificial intelligence can almost like alarm you before a complication will happen. So think about this. You're doing something in the OR, and you may be alarmed that the patient, will have a thrombosis, or a patient is developing infection and it's not clinically evident. All these things, it's going to make our life so much better. And it's not that it will replace us; it's going to be complementary to what we do, and that's why I think it's very exciting times for us.
Yeah. Speaking of complementary, I wanted to talk about you guys and your, partnership and this incredible duo that you guys have built. I'm curious how you guys
I don't know
first
about
met
that.
and when you realized.
So tell us about your partnership and like where it all started, where you guys met and things like that.
So we actually met during one of the, I think it was ORC, one of the conferences. And obviously we trained at different institutions and we didn't know each other before that, but kind of we quickly realized that we had kind of similar interests, not only plastic surgery wise, but also kind of education wise, academically, for international collaboration, things like that. So we kind of stay in touch around that time, and slowly we started collaborating a little bit more. I mean, we kind of share the same vision to do this meeting, right? So, and at some point we kind of decided that we wanted to move forward with it. And I mean, we do a lot of other things together. We collaborate academically. We do papers together and things like that. But that was, I think, the turning point where we started doing a lot more work together.
And then
Yeah.
where did that come up? Like who brought it up in conversation? Like who was talking to the other person? Where you guys, because I know talking to both of you individually, you've all had an interest. You both have had an interest in being clinical in Greece. And so how did the idea even come up, and where did you find a need for it? One thing that Hank and I always talk about, which is why we love this podcast, is that we have so many conferences, right? We have so many conferences. Like I can name 5 without even thinking. But then you guys started this conference and it's exploded, and it clearly filled a gap that most people wanted. So what was your original idea and the vision behind it?
George, you want to take that?
Yeah, I was about to say that it's interestingly enough, we both had the same idea separately. And when we started, when we met each other, as Chris said, a few years back, we both said, oh, I was thinking of starting a meeting in Greece. And I think the background is, you're international graduate, you come to this country, the idea behind, and the paperwork, when you fill the paperwork initially and you apply for visas, the whole idea is that you'll come here, you'll learn something, and you'll take it back to your country, right? And honestly, a lot of this is you come here, you learn so much, you network, you meet all these people, and you're like, I want to be able to bring this to my country, right? And I feel like both Chris and I had the same vision. It's Greece, the Mediterranean is far from the US. There's high quality meetings here, and world-renowned surgeons that for us, you just travel 2 hours away on a plane and you can go and watch them talk. And so for us, it was more like, let's bring all this expertise from all over the world, not just the US, but all this expertise into our neck of the woods, and allow the people there, the regional plastic surgeons, to just have a short trip to come and see them, if that makes sense.
This meeting, it's the 3rd annual Mediterranean Conference of Plastic Surgery Innovations. And I'm just curious, how difficult it must be to plan a meeting out of the country in the Mediterranean, I'm sure there's so many more hurdles and things that people don't appreciate. So I just want to thank you guys for that. It sounds like it's going to be incredible. I've never been, but I'm excited to go this year. And I'm just curious, when you guys were planning this, did you guys think, we have to bring something different to the table? If we're going to attract these people to come all this way, how can we bring, a new angle to what's already out there?
And then the other thing that I'll mention too before you guys jump on that is that one thing that I love about it personally is the fact that it combines aesthetics and recon. That's one of the things that I love about ASPS. So anyways.
Well, yeah, let's start with the aesthetic and recon. But I think the first year, what we wanted to do, there was a gap in microsurgery in this region, right? I'm in Cyprus right now, so I can say in this region because I'm here. So, but a lot of people shy away from microsurgery because they don't have potentially the appropriate training or they haven't seen a huge number of cases, or they don't have the people to discuss this case, their colleagues to discuss cases with, right? So, and all the support that they need. So we started this with the understanding we wanted to fill that gap, right? So in the first meeting was actually only microsurgery, was based on microsurgery. And it was very successful. But then the second time around, we thought, modern plastic surgery is reconstruction and aesthetics combined, right? So even though many of the innovations developed in reconstruction, they eventually influence aesthetic surgery and vice versa. So we thought that we should combine the two and allow surgeons to kind of cross-pollinate their ideas in some way, shape, or form during the meeting, right? Because we shouldn't be kind of thinking in silos, and that's why we kind of brought the aesthetic portion into it, and it was actually very successful second year around, and wanted to continue that this year as well. So
you talked about the original concept, the recon, the cosmetic aspect of it. So you go from this idea to then you guys both agreeing, okay, we have to do this. Who did you run it by, people like mentors, and tell them, we have this great idea, we want to do it, or did you just run with it? And when you ultimately decided you wanted to do it, what are the steps like for anybody in the future who wanted it? Because this is a hugely successful meeting. You guys have done it so well. It's extremely well attended, and people are super honored to go. What are the steps from, okay, I have this great idea, now how do I bring this idea into a reality?
I will say that the success of this meeting is just it's the epitome of community. In other words, you have your network, you have people that you work with, we go to all these meetings, we collaborate, we talk to people. Both Chris and I, because we had we had long pathways. We went through so many different institutions, met so many great people along the way. And when it was time to put something together, we had a long list of people that we felt comfortable reaching out, asking them whether they would want to come and support us. The other thing is, if you think about it, it's a little bit like a destination wedding. Who doesn't want to go to either Cyprus or Greece or Crete this year, or Athens, a couple of years ago, or Crete this year, in the summer, have a great time. And so all these things together, they only made sense. Then
yeah, you do what you love and you have a good time at the same time. So you give your talk, you educate people, and they have a good time at the same time at a great location. So it's just hard to beat that.
Yeah, I actually want to give you guys, a few moments to just like broadcast, about this year's meeting, as you just alluded to in Crete, why it's going to be special, who's going to be there, what can people expect, and why people should make the trip out there.
Yeah, I mean, it's a meeting where we have a lot of great speakers from all over, right? Obviously, we're trying to bring um, American speakers to the region, but it will also involve speakers from the region, well-renowned speakers from the region. And I would call it a remarkably approachable and friendly meeting. And what I mean by that is that faculty don't just disappear after the lectures like some of the bigger meetings. They're around. They hang out together with the attendees. They're willing to discuss cases and kind of meet people. And we hope that those relationships will continue after the meeting, right? I think that's the important thing for a lot of these attendees who want to not just learn, but also network and maintain some of those relationships for supporting whether that's their practice or their training in the future and things like that.
Both the aesthetic and the reconstructive program is the who is who of, aesthetic surgery, reconstructive surgery. We encourage people the program is up, it's live on our website. There's so many names, so many people that will honor us with, their participation. And I mean, I cannot, not mention that Dr. Saeed Azuri will also be there. So, it's a great opportunity for everyone to get to talk to him.
Yeah.
Thanks.
There will be some deep end podcasts that are going on. If that makes people want to go, or if that makes less people want to go, I'm not sure.
Yeah, thanks so much for inviting us to do that. That's going to be a lot of fun. You also partnered with the Aesthetic Society, which is
Yes.
huge. So I want to hear about like what that partnership offers for the conference. But yeah, so thank you very much for inviting Hank and I. We're super excited, and you guys are allowing us to do it during the coffee sessions, which will be a lot of fun. And our vision, Hank and I have been kind of talking on the side, our vision is kind of do a 50-50 split with recon and aesthetic surgery to highlight some of the amazing speakers that you guys have. And it's pretty impressive. Since day one, I've been following this conference and you guys never invited me to the first or the second one. But since day one, I was following it. And even at your
I'll
first
stop you
conference.
there and say we invited you, but you didn't want to come.
Yeah. But you had the who's who in plastic surgery since your first conference, really. And I think it'd be really neat if you guys broke down, I'm sure you're doing this, but you should do even a publication or something, but break down the attendees and the guests, like the faculty based on country. I think that would be really exciting.
And we've done that actually. We've done the first, the second meeting, we had people from about 15 countries, I think 16 countries, like something like 15 states in the United States. And the first one. The second one, we had more than 25 countries, and it was from all over the world.
Wow.
And again, a bunch of different states from the US. So we were trying to keep track of that, and we also had a lot of abstracts this year, close to 100 abstracts, and you can see places like Philippines and other places. I don't know how some of these people hear about the meeting, but it's impressive to see that people from all over the world are interested to come. In terms of the collaboration with Aesthetic Society. We also collaborate with the Aesthetic Society and also with ISAPS. And
cool.
there's opportunities for membership, a lot of prizes for both of those organizations. And I think they're great opportunities for someone who's interested in joining those organizations. So I'll encourage everybody to get on our website and just click on the on the link there and just look through what's available. But both societies are excited. We have a lot of speakers from within both societies, and was super excited for that collaboration for sure.
I was about to say that the proudest moment for me was when I was in Prague for the Euro Micro meeting, and someone approached me and they said, "Oh, there's this conference that is happening in Crete this year, the Mediterranean." And I said, "Oh, you know what? This is our meeting." And the reason why I say that is
That's
because,
amazing.
as you said, there has been an exponential growth of, this meeting, started from a small group of friends getting together, having some talks, to now. Our challenge now is that there's so many people from all over the world that we would like to invite, but it's still a small meeting. And I think the challenge moving forward will be, how can we get as many of these amazing surgeons to come and share their expertise without making it too big of a meeting. So I think that's a little bit of a challenge.
It is a huge challenge, and it's a juggling act. We deal with the same thing with the Pen Flap course, where we have so many attendees from all over the country, all over the US, and then you feel bad not inviting the people that have come in the past. So you tend to invite a lot of the same people, but then you want to branch out. So it is a juggling act. But I could imagine the feeling that how you felt when somebody came up to you, and that being a very proud moment. So is there going to be a special themed welcome, you should have an all white party? I think that's how, an all white party on the beach or something like that.
We talked about that. We did. What we try to make unique about this, not just bring the same speakers from other parts of the world, just in Greece or Cyprus, but also give it a little bit of a local cultural twist to it. So starting from the first meeting, our social events were very included local dishes, obviously, food, as well as dancers, things that are very specific to the local culture. And I think we're going to try and do something similar this year with Crete. Crete, they are people from Crete. They're very proud of their food, their olive oil, as well as their dancing. So there's going to be a lot of that.
That's exciting.
Get ready to drink some olive oil this time.
Yeah.
If you had to sum up the future of the meeting, what would you say? What is your goal for the future?
Chris.
So I would like to see this being one of the premier international meetings, not necessarily just the biggest meeting, but one that's kind of known for not only exceptional education, but also for meaningful networking, and also for innovation and the way things are presented, and also something that is fun for people to go and have a good time while they're taking advantage of everything else. And we also hope, and I think George has the same vision as me, to serve as a bridge between different regions of the world, right? To kind of be able to bring people in the Mediterranean from all kinds of different places.
I was about
George.
to, also say that, the Mediterranean, the geographic region of the Mediterranean is more than just Greece and Cyprus, obviously. So hopefully in the future, we can get all these other neighboring countries to be more involved. We have speakers. Maybe in the future, we can have the meeting being hosted in other countries as well. Yeah, I was about to say that what's unique about this part of the world is, the hospitality. So people have to not just experience a scientifically sound conference, but also the hospitality of those people over there. And that's something that I think will be the staple of this meeting.
Yeah.
And we're trying to find people who take on this meeting and treat it, I guess, with so much love like we did, right? So to show their country in a way that people want to see it when they come and visit for 2-3 days.
Yeah. Well, we want to thank you so much for taking the time to join us on the Deep End podcast. I think this is going to get everybody super excited to come to this meeting. I know we are, and we're honored to come as the Deep End podcast to do some live episodes while we're there. But two final questions that I have to ask, since you guys are guests on the Deep End, and we always ask these, are what music do you listen to in the OR, and what is your favorite surgical instrument? Whoever wants to go first.
I listen to some EDM music, and
Nice.
if that's not available, I usually ask them to just type Mykonos, Scorpios,
I was gonna say
club,
nice.
and
That's
it's some
the number
nice,
one club in the world, I think I saw.
yes, some nice
It
vibes
was
there.
rated.
Music is
Yeah.
great. And my favorite instrument is McCabe. It allows you to do fine dissection.
I agree.
I love that instrument.
That's a popular
I love that
one.
instrument.
Chris.
George, that's not fair because you went first, and I was gonna say my cave is my favorite instrument too. So
Well, that's why we're
can't think of
friends.
another. Yeah. Right. Yeah. Exactly. So, yeah, my cave is my favorite instrument as well. In terms of and the bobby too, right? The bobby is great, right? Because you can go through anything you want. But in terms of music, it's usually I let the residents pick, but Hipster Barbecue is one of my
I like
favorite
that.
picks, you know?
Yeah,
That's awesome.
That was like an original from way back when. I think we were listening to that in George and I at Hopkins.
Yeah.
Yeah,
Okay,
Hipster Barbecue, Hippo Barbecue, those are always good.
Last
I do
question. What is one dish everyone should try when they're in Crete?
Oh, that's the hardest question. It's not just one.
Or
I mean,
whichever
it's
comes
so
to your
much,
mind first.
so much amazing food. One thing that they do those small cheese pie with honey, and it combines that
Oh.
savory with
That sounds good.
a little bit of it's great. It's so good, but all food is amazing.
That sounds great.
I do want to say one more thing. So we were all at
Yeah.
PSRC where you guys did the first live session, and I have to say it went
Yeah.
very, very well, right? So it was a
Yeah.
room
Thank you so much.
full of people. I feel that that was a good opportunity to see how doing a live podcast can go. So I'm encouraging people. We'll post it on our website when those sessions are going to be, but they definitely have to attend those. They're going to be great.
Thank
Thank
you so much.
We appreciate it.
And you have some great people too. I mean, these are visionaries in the field. So I think that combined with your delivery, I think it's going to be amazing.
Thank you so much.
you
It's a
so
huge
much.
honor. I'm going to start packing right after this podcast, actually.
Thank you guys for having us. We appreciate it.
Thank you.
We're looking forward to welcoming you to Crete this year.
Thank you for listening to The Deep End, a plastic surgery podcast. If you've enjoyed today's conversation, please like, subscribe, and leave a rating on Apple Music or Spotify. Video from the podcast is available on Instagram and YouTube at The Deep End Podcast. Join us again soon for more conversations with luminaries and experts in the world of surgery.